and with really, really big news. Our conversation brought to you by Marcus and Mack, a law firm representing injured people. Dr. Clark, this is a big deal, isn't it? We've been working at this for a long time.
It's been over 2.5 years in the making.
Wow. Wow. 2.5 years to finally, I'll let you say it because you'll say it so much better than I. This accreditation is officially, what's the designation?
Well, we're nationally certified now by the National Accreditation Program for Breast Centers. It's run by the American College of Surgeons Commission on Cancer, the same committee that certifies cancer centers across the country. And it's a very rigorous, very difficult certification to get. And like I said, when I was recruited back over 2.5 years ago, we talked with the administration and said, you know, I really want to be at a center that does this because breast cancer is very much a part of my practice, and I'm very passionate about treating breast cancer. And they were fully behind it. And it took a lot to get here. And now we are a nationally certified breast center.
It's a really rigorous process, isn't it?
It very much is. There's 17 different components to it. It's not just the breast surgeons. It's not just imaging. It's also everybody has to have CME, which is continuing medical education, which means not only the surgeons, but the medical oncologists, the radiation oncologists, the radiologists, the physical therapists, you know, everybody who's involved in breast cancer treatment has to maintain their educational requirements. We have to meet all these standards for imaging and biopsy and oncology and surgery because, you know, breast cancer treatment changes yearly, and because there's more research in breast cancer than any other cancer out there. And as a result, we make advances in it. You know, I have to maintain my CMEs in genetics to continue the genetics program that I brought here as well. It's an extremely rigorous program.
Now, that being the case, from a patient standpoint, talk about some of the resources that will now be a part of their cancer treatment at IRMC because of this designation.
Right. Well, actually, there's 17 components, so I have to put my glasses on to even remember them all. When you look at the components that are involved, you know, breast imaging. You know, we've upgraded everything to 3D mammography throughout the system. We also have the breast MRI now as well. But it's not just that we have them, they have to be certified. And so they're certified by the American College of Radiology. You have to be able to do needle biopsies because you shouldn't be doing surgical biopsies when there's a better alternative to that. And it's not just ultrasound and mammographic guided, it's also the MRI guided, which we have now at IRMC as well. You know, pathology. The pathologist has to be up to date on all the standards of the reporting and how to report it and what to look for and everything else. And that was never an issue. You know, and like I said before when I've been here, most of these components were in place. Some of them we had to address, but most of these components were in place before I got here. But it's been a rigorous in upgrading all of these components.
The journey to accreditation, of course, requires not only buy-in from the hospital management, but from the people who are actually there on the front lines of this battle. And so you needed to have a full commitment from everybody in the process, did you not?
Right. And, you know, we worked hard for this as a team. And there's, as a matter of fact, later today we have our breast program leadership committee, which is actually one of the requirements for certification, and that you bring all the components together. And we meet right now on a monthly basis, and we've been doing that for over 2 years. And we all talk about the breast program, and it's the breast program director, which is me as the breast surgeon, pathologist, radiologist, my partner, Dr. Bill Moria, and other breast surgeons on there, medical oncology, radiation oncology, physical therapy, social work, hospital administration, a community rep, and then, you know, they say other reps as designated by the director. So we have other people on the breast program leadership committee. Darla DiCarlo, who's the director for radiology, is on that committee and has done just an unbelievable amount of work to get this certification.
Why to you was it so important that this accreditation come to IRMC?
Well, around the region in the country, there are people who are treating breast cancer not necessarily up to the current standards. And this makes you be at the current standards. For instance, radiation oncology. we're now affiliated with the University of Pittsburgh, School or UPMC Hillman Cancer Center with our radiation oncology. We now have to follow rigorous guidelines. That wasn't necessarily happening. When you have independent doctors doing things independently, then you don't necessarily get the best care, but you get the care that that person thinks is the best care. And maybe that's not up to date, and maybe it was the best care 10 years ago, but it's not the best care now. One of the changes I made in the Department of Surgery when we got there is that every surgeon was doing a little bit of breast surgery, and that's not the best way to do things. You really need to focus on it, and you really need to specialize in it. So now it's just Dr. Billamori and I, because she really had a special interest in it and has kept up her CMEs, and she really has a passion for it like I do. So now we are the only two doing breast surgery because we can now have focus, and our offices are right next to each other, and can't tell you how many times we're in each other's offices, discussing a case, and we're looking up the latest research on it. And we just did this yesterday with a case, so that's the thing behind certification. It forces you to follow national standards and guidelines, which doesn't always happen across the region and across the country.
Dr. Dan Clark in the studio with us this morning, and we are physically distanced and masked up for this conversation as we talk about IRMC being designated now as a breast cancer center in America, and what a big deal that is for this area, for this entire region. IRMC has at its fingertips now the latest technology, the latest information, all of the latest resources that normally in past days we would have had gone to Pittsburgh for. UPMC Hillman Cancer Center is a big part of that whole mix.
Right. Yeah, and all those components are part of it. We brought on a plastic surgeon who I've worked with for many years doing breast reconstruction. And he is a very well-respected Dr. Fran Johns, who does a lot of breast reconstruction. We brought him into the mix as well. He's now on staff here. Like you said, the affiliation with the Hillman Cancer Center, the Hillman Cancer Center has their own guidelines that they follow, and they're very rigorous, guidelines, and they're at the forefront of research with breasts. And so when you go into Pittsburgh, and you go to McGee Hospital, which is a great hospital, they do great work, you're not going to McGee. Hillman Cancer Center runs their protocols. We now have Hillman Cancer Center right on campus at IRMC. So we have the same protocols that you get at McGee or Hillman Cancer Center available right here in Indiana now, too.
When we visit with you and Dr. Billamori in October for Breast Cancer Awareness Month, of course, the number one emphasis right from the start is early diagnosis and therefore screenings, and that still is very, very important, and IRMC is better equipped now than ever to help with that process.
Correct. And, we with the 3D mammography available in Blairsville and our main campus now, it's available. Prior to COVID, we used to have walk-in days where you didn't even need an appointment. Unfortunately, like everything, COVID has put a wrench in that, and hopefully we'll get back to that. But the studies have clearly shown that early diagnosis leads to better survival. And having mammograms beginning at age 40, if you're an average risk woman, has been shown to improve long-term survival with breast care.
Of course, from the genetics end of it, those screenings might have to come earlier, as you have been very, very much submerged in that entire process of identifying that and bringing that to IRMC as well. Talk about that and how it adds even more of a diagnostic tool to you.
Genetics is exploding. I've been doing genetic counseling for 10 years now, and I started because my own wife had breast cancer at a younger age, and we went for the genetic counseling, and I was very underwhelmed with what we received. And I thought, you've got to be able to do better than this. This was not a good informative session. So I immersed myself in it, just like I do with anything I do. And I read about it, and I learned about it, and I became certified to become a genetic counselor for this. I'm kind of grandfathered in there. It's when we go through this certification for the NAPBC, as we call it, the National Accreditation Program, you have to have somebody who is qualified to do genetic counseling. And I fit those qualifications by their national certification requirements. But we found we're now doing 35 genes. Everybody understands it's BRCA1 and BRCA2 are the two main breast genes. We now know there's 11 genes that can cause breast cancer. It's not just BRCA1 and BRCA2 anymore. So unfortunately, some insurance companies, notably Medicare, will only pay for BRCA1 and BRCA2. And if a woman has a family history of breast cancer, that may not be enough. There are 11 different breast cancer genes out there. And we test for 35 different genes in a panel called a MyRisk panel that looks at all the current genes that are known to cause all different types of cancers.
All right, so from screening all the way through the process of treatment for breast cancer, IRMC is obviously the place to go for this region. And others from outside the region can be very, very comfortable coming to visit IRMC for that same purpose.
Right, and the one thing I'm very proud to say that there are 28 centers in the state of Pennsylvania who have achieved this national certification. Of all the hospitals and places that treat breast cancer out there, there are only 28 in the state. We are the only one west of Harrisburg to have achieved this certification. There's nobody else in Altoona, Johnstown, Greensburg, Pittsburgh who has achieved this national certification by the American by the American College of Surgeons. It's quite an achievement for the region to be the first and only national certified breast program.
It is that's an amazing thing to say. And I know you have to be proud not only of the staff and everybody who is involved in this process, but IRMC to make that commitment as a whole has to make you very, very proud to be affiliated.
Yeah, and I'm going to miss people who have worked on this because there have been so many people, but Dina Deal, our nurse navigator who's been on the program with you before, is key in this. She guides the patients through it. That's a big part of this. Sue Majoris, who was our first nurse navigator for IRMC, she started the nurse navigation program long before many other hospitals even considered it. And she was instrumental in helping us get through this and working through it. I mentioned Darla DiCarlo, Jillian Chelensky, who was my, administrator, who has really done a lot of the legwork for me as well. And the administration, they were just fantastic with all this. And so Steve Wolf was behind this from day one. When I met with Steve and was being recruited and talked with him about this, he was 100% behind it. He wants us to be a true regional medical center and to provide the best possible care we can to people. The administration supplied the funding and the backing we needed to get this accomplished.
He is Dr. Dan Clark Mozart calling you there a second ago. Thank you so much for coming in to tell us about this. This is exciting news.
Thanks. It's always a pleasure.
Have a wonderful day today.
Thanks.
It is the voice of Indiana County, WCCS, 101.1 FM and AM 1160. Fox News up next.